Hello, everyone. Welcome to another episode of Sunday Speaks. As always, I'm Cheyenne Severin, and this is.
Mustafa Rabboh, Chief of Police of Bergenfield.
hmm So, before we started, we had a small conversation just about what we were going to talk about today and everything. And you had mentioned that you don't just work with Bergenfield, or.
Right. Well, I work in Bergenfield, but I have conversations about the opioid epidemic, not just in Bergenfield, but also where I grew up, which was South Patterson. Different community, different faith, so they're handled a little bit differently. So it's a battle of two. So I try to discuss with both communities as much as I can and educate as much as I can.
If you would, could you just clarify what you mean a little bit by different faiths, or.
Okay. Where I grew up, which was South Patterson, not sure if you know a little bit of history about myself. I pretty much grew up in Patterson, went through Patterson school systems, Patterson police officer before transferring over to Bergenfield. I lived in South Patterson for the majority of my life, and the faith predominantly in that community is Muslim. And if you think it's a stigma in any other communities, that's probably one of the biggest stigmas that you'll see in that community because of the faith, and it's something that's not talked about. No one wants to talk about it, although it's prevalent in that community just as much as anywhere else. Fortunately, we haven't cracked the shell of having people come out and speak about it more freely because the stigma is still there more so than other communities.
So, what have you found is the best way to combat stigma in areas where you have found success?
Education is key. If we can get through to people to tell them that um, this is a this illness is a disease and not a stigma, if we can get people to come forward, just like any other illness that they get, God forbid, whether it's cancer or any other illness, and just say, hey, this is what I have. I need help. Unfortunately, with this epidemic, people don't come forward to say, these are my issues, and they most certainly don't come forward to say, I need help. I can't tell you how many times, especially in the Muslim community, that you hear a young person in their 20s, whether male or female, the parents would say they died of a heart attack. How many young people that age die of heart attacks? A lot of it is the overdose. They just don't want to admit that their sons or their daughters died of overdose because of that. That's where the problem is. And if we can't talk about that stigma, how do we get through to educate the rest of the people? We all try to learn from each other's mistakes, but unfortunately, we keep repeating the same mistakes.
So, we'll get to preventative measures and talk further about that education in just 1 second. But when a dangerous situation arises, like someone is at risk of overdosing fatally, there's something that has been put in place in recent years, the Good Samaritan Law. Is that right?
That is correct. The Good Samaritan Law, also known as the Overdose Prevention Act, I believe it was started in 2013 by then Governor Chris Christie. That's a powerful tool for us. It helped save many lives. I'm sure that in the past, prior to this act, people would overdose, and the people that were with other people that were overdosing would be fearful of contacting the police because they didn't want to get in trouble. What this law has done in essence is to say that if you're with someone or even yourself, if you are overdosing, we want you to call 911. We understand this is an illness and you will not be arrested, prosecuted, or convicted if you're calling on your behalf or somebody else's behalf that's going through an overdose. But we want you to make that phone call. We want you to stay with that individual. We're not there to arrest you or the person that's overdosing. We're there seeking help for you, to get you to the hospital, to get you the medical care that you need. That's first and foremost. Our goal is to supply the help without going through the legal system. So you are immune from arrest, prosecution, and or conviction as long as you act in the faith of that law.
hmm So, that's obviously helpful and good to know for anyone who finds himself or could find themselves in that situation. But going back for a second to preventative measures and education, how young do we start education for substance misuse?
Well, I can tell you how young we started from a police officer standpoint. We had wonderful, I would say, recovering addicts from Alumni in Recovery come speak to our sixth, seventh, and eighth graders. We start that early. We've done it in the past where once we've had the Youth Academy, we've had the Alumni in Recovery come in and speak to those kids. So really, we've started that early, and it makes a difference because at the end of the day, if we can get through to that one individual, even if it's just one, if you really think about it, it's more than one, because if we can save that one individual, we can save the grief of the family of that individual. And for me, one is a success. So that's what I'm hoping to get. We teach at the middle school level. We also work in conjunction with the Bergen County Prosecutor's Office, where we also do seminars at the high school level as well. We did it as well a few weeks ago with Alumni in Recovery, and it was a great turnout. We got a lot of great reports back from it. I think it was successful. And again, there's no age too young. There's definitely no age too old, because I can tell you one thing. The names that come across my desk or the overdose victims that I've seen through stats, I can't tell you it's going to be a male between the age of 30 and 40 or a female between 35 and 45. There is no stat that can truly depict what effect affects everyone. In other words, it's the young, middle class. I'll say the old. I've seen the educated. It's really a disease that affects all of us. It doesn't care who you are, where you're from, your religious affiliation. And that's why I think it's important to start at an early age and educate. And you'll hear me talking about this a lot, is education over rehabilitation. Before, if we can educate in order to save the rehabilitative process, I think that's a home run for all of us.
So you had mentioned middle school. To your knowledge, do the schools in your area institute DARE as a program that the kids go through in elementary school, or?
Yeah, they do have. We have numerous programs. There is one of them. Stranger Danger. We have a lot of programs, but as far as for the drugs, it is there. And now we're starting to get Alumni in Recovery, and thank you to you guys for all the work that you do to come out and speak to these kids. Because at the end of the day, them coming out and speaking to these kids, and some of your presenters are so young that these kids can relate. Mm-hmm. For me to go and talk about it, it's great, but do the kids really relate to me? They see me as the chief of police, maybe somebody who hasn't been through this. The recovering addicts are younger, and I choose my words carefully. I don't want to say a lot younger. I don't want to age myself, but they are younger, so kids are more in tune with them, and especially the recovering addicts that went to our school system from Bergenfield, so they can relate and they can put themselves in their shoes, and it touches closer to home when they speak. And it's been a wonderful program to come to speak to the kids about.
Mm-hmm. So that's amazing. My brother just went through his DARE graduation last week, and they talked about how the program has changed a lot in recent years. So even when I was going through it, and that was like, what, 10 years ago already, there's a lot more focus on mental health and everything. Like more, like you were talking about, social situations, even separate from other programs, like just say no, but why should you say no, and all of that. So forget where I was going with this, but there was a point. Oh, right.
Well, actually, I'm glad you mentioned that, because I always ask the students, what do you think my most important tool that I have whether it's on my gun belt or in my car. And I'll tell you what, it's that Narcan nowadays.
Mm.
20 years ago, about 20, 22 years ago when I first started, if you told me Narcan was going to be the most important tool that I had as a cop, first of all, I would tell you, or I'd ask, what is Narcan?
Mm-hmm.
And second of all, I would say you're crazy.
Mm-hmm.
But nowadays, I think that's the most important tool that we have. Every single police officer is trained on the use of Narcan, and every single police officer has a Narcan packet available in their car. So we were able to save many lives with Narcan that obviously 20 years ago, we didn't have it in our possession. So that's when you talk about as far as the drugs have changed or mental health illness, right? Back in the days, it wasn't so much the opioid epidemic. Now it is the opioid epidemic. And what have we done in order to adapt with the times? And that's where Narcan comes in and, educating and hopefully not rehabilitating.
So Narcan is a big thing. Most of the time, Alumni in Recovery partners with Black Poster and goes to their events and everything, and they do Narcan training there, and it's readily available in some places online from reputable sources, obviously. So yeah, Narcan is pretty big. The one thing that I noticed, or realized, I think talking to someone else in the past, through this series, is that there were multiple forms of Narcan, so it's not just like the nasal. It's,
All right.
yeah. What are the other?
Um, you're going to put me in the spot here. I believe part of it is, I want to say injection, but we use the nasal. That's the ones that we're trained in.
Mm-hmm.
And let me tell you something. That is amazing how that works. It's not just it neutralizes, it reverses the effects of the opioids, and it's been a blessing for us. I pray that we never have to use it, but we do use it in times of need, and it's been very beneficial to have. So as far as the different methods, the one we use is the nasal.
Going back to the previous question and answer, you had mentioned mental health, which is where I was going with the dare thing previously, actually.
Okay.
It's just mental health is something that comes up quite a bit in this series, actually, just in regards to its relation to recovery and substance misuse. So, what do you and your department do, or larger, you know what I mean, do to help with the mental health aspect of recovery, or in general, even?
Well, we have we work in conjunction with the Bergen County Prosecutor's Office to assist people in times of needs. In times of need, what I mean is if somebody commits a low level crime, a low level crime, maybe such as shoplifting, but that has a nexus to abuse of alcohol or drugs, to keep them out of the criminal justice system, we will offer them a alternate program to seek. Right, if they go through this program, the hopes are that they don't have to shoplift to feed their habit. Mm-hmm. And ultimately, that's what we want. Because to arrest somebody for shoplifting, we're just masking the problem, right? It's going to happen again and again and again. So we hope to get them through the system where they can seek help, where they don't have to shoplift to feed their habit. And that's something that we've been doing for the past 3 or 4 years. We've used it on a few occasions. And as far as I know, the people that we've used it on have not returned, which is great. It tells me that it's working. So that's a start as far as what we've done in the community to kind of assist in getting somebody help as opposed to just making the arrest and having them go to the criminal.
So is that part of the wider movement of decriminalization then, would you say?
For low level crimes, right? So we're not if somebody commits, say, a serious crime, God forbid, whether it's murder or sexual offenses, that does not pertain. It's something that has to have a nexus to feed their habit, right?
Yes.
Most cases are involving shoplifting because they utilize whatever it is they take to sell, and then it feeds their habits, or whether it's even shoplifting alcohol as well. So those are the people that we can help. As far as the serious crimes, those are much more of a higher magnitude that different aspects have to be taken into consideration.
Yes. But why I mentioned that is because of that, like we were just talking about, that increased focus on mental health, and taking into account substance misuse as something that needs to be conquered for people to be able to become more successful in their recovery. So when you're decriminalizing certain things, people just most of the time hear that word and they're like, oh, well, I guess people can just misuse substances and there are no consequences at all. When in reality, instead of being arrested or going through, like you said, the legal system, it's more so getting them the help that they need. Is that correct from your perspective, or?
We want them to get the help that they need if they have an addiction, right? We're not
Yes.
saying go get addicted and then commit the crimes.
No.
We're saying if there's an addiction and this is these are the low level crimes that you're committing to feed that addiction, we want to try to eliminate that addiction, try to save you from committing the crimes over and over again. Because those low level crimes, if unchecked, tend to become higher level crimes. So that's why we want to end it there, because just like anything else, it will start small. If it's not addressed, ends up getting bigger and bigger to the point where it's tough to address. So that's what I mean by low level crimes as far as minor crimes with a nexus. They have to have a nexus to their addiction.
Yes.
It's not just your normal person who's shoplifting because for whatever other reason. So they'll still be prosecuted. It's just those people that have an addiction that we're trying to help out.
Yeah.
There's also a lot of, we try to teach individuals, education, like I always say. You can discuss the appropriate use of the opioids. We talk about taking prescribed dosages, right? Not sharing medications, properly disposing of unused opioids. We actually started something about 7 or 8 years ago. We have what's called a Project Medicine drop box in our headquarters. It's it looks like a mailbox, basically. It's in our lobby, and it's accessible 24 hours a day, 7 days a week. I try to tell people, look in your medicine cabinets, right? I know growing up, we always had the remaining medicines that we didn't take. Nowadays, kids are more curious, and we encourage the parents or the adults go in their medicine cabinets and check for any either expired or unused medicine or medicine that you are no longer in need of. Take that medicine and drop it off in the Project Medicine box in our headquarters. That gets destroyed. If we can keep even those pills out of the hands of minors, I think that's a start. So these are some of the things that we're trying to do to combat this epidemic, but we all have to play our part. And it starts at home, in the schools, with us. So everyone has a role in addressing the system.
On that note, we are just about out of time. Are there any last comments, questions, concerns you want to say before we end off today?
Oh, I think stigma is the biggest issue facing not just one community or another. Again, I wish people would be more open-minded and to say that my son or my daughter has a problem. Because if you look at all of us, we came from different backgrounds. We're at different places in our lives. We have a commonality in addressing this issue. I've lost many friends and dear friends to me from the epidemic, right? So me as the chief of police, I'm not going to sit here and tell you it hasn't affected me. It's affected me tremendously. I have family members who are currently addicted, but the hardest part is getting them to admit their addiction and to speak. Once we can discuss that in an open forum to say, hey, what you have is nothing to be ashamed of. It's an illness. It's an illness that we need to all combat together. I think it'll make our jobs a lot easier. We all have an important role, whether it's governments, healthcare organizations, community groups. We all play a role in promoting the opioid education through public health campaigns, school programs, healthcare provider trainings, and community outreach initiatives. I think if we can all get together and collaborate effectively, I think that we can try to ease the burden of this epidemic. To eradicate it is, it's a tough task to take. However, we can start slowly, and if we improve the life of one person, that in turn improves the life of multiple people, family members as well. And just one last thing I want to close in saying, I know we always discuss the individual that is going through this overdose or going through the addiction. I think we need to address the family members as well because they have to deal with it, right? It's tough to see a parent, a father, a mother, a brother, or a sister, and their loved ones go through this. A lot of times those people going through through their addiction are shunned, ostracized. It takes a difficult role or task on the loved ones to go through and to see what their kids are going through. So I think we can have an outreach for the family members, kind of educate them on the signs, what can they do and how can they help. I think that would be beneficial for the family members as well because they too are very much affected by this.
Thank you so much for coming on today and sharing everything, basically.
No, thank you for having me. This is a job for all of us. So it starts with us and anyone that can help. Please come out and help. Do what you can. Thank you so much.
Thank you. Have a nice day.
You too. Take care.